See? Let me do this slideshow and then we'll Yeah. Good afternoon again. So I'm going to briefly take you through a kind of concept, not just a concept, a campaign, I would say, for at least for the rest of my life that we're going to take on. It's about how do we help children in Nepal. Obviously, I'm a doctor. I'm going to talk a little bit about myself probably at the end, but this is going through helping kids, sick kids, and maybe trying to prevent diseases in children in Nepal. And there are a lot of physicians and the business community here who would relate to me how hard is it in Nepal to provide optimal care, even to adults, let alone the children. You know the location of Nepal, the geography, the difficulties, the economy that we have. So I'm not going to repeat all of that. I'm going to just skip some of the data, but let me start with some positive stories, even back in Nepal, that I was lucky to have. Well, if you know, many of you probably have heard, that Nepal has made significant progress in reducing childhood mortality in a few decades. And going beyond that, I'm a heart surgeon. I do pediatric hearts, and I was trained in some of the great institutions around here and in North America in pediatric hearts. That's why I'm passionate about it. And Nepal actually has waived the fees of operations for every child under the age of 15. Of course, we advocated, lobbied for it. We had the pain of seeing these people suffer that needed cardiac surgery. There are other schemes also that poor Nepal has afforded to bring in. And there are thousands and thousands of stories. I myself probably did 14,000 some operations, and of which probably 5,000 plus would be in children alone. And we can share with you thousands of stories that kids had a second chance. And the reason I'm bringing this up is these kids who got a second chance have now great dreams that you and I cannot even fathom. You know, these examples, I'm going to skip these videos. This guy say, I'm going to be a doctor, I'm going to be a scientist, I'm going to do it. And you know, these kids have grown in the last 25 years. The first operation that I have done, now working in top universities, going through the universities in the UK, US, and all around the world. And these guys can just do what they say now. These dreams would not have been possible if they hadn't gotten a second chance. So there is a value of talking about these misses that we still see in our country. And I'm going to tell you, I'm going to take you through the numbers just to make aware of why we are so bothered about this. And a lot of times we tend to oversee these numbers. And in our villages, people say in Nepali, Koirala, 6 born, 3 alive. And they take it normally. That's not normal. And as a reminder of these success stories, I can tell that these 3 lost could have been anybody in this world. And that's the reason that I get really passionate and stimulated about trying to save these lives. Can we save all of them? Probably not. But the numbers still are very painful today. If you see under 5 childhood mortality is 33 per thousand, that means 3 children out of 100 do not see their 5th birthday. That's not normal for the current today's civilized world. Infant, 28, and neonate, 21. So that means that this is still high mortality, despite the fact that Nepal has done tremendous progress in immunizations, water and sanitation, community-based infection treatments, and that's how these numbers came from far above to these numbers. But what has happened in these last 10 years is these numbers are not going down anymore. I think that's where the buck is. That's where the thinking process is, that now the number is not going to come down until we start focusing on a little more complex things, a little more treatment focus areas where they really get sick, we can prevent diseases, then they have no place to go. I mean, there are some places to go, and I'm going to talk about those resources today, what we have in Nepal and why we needed to take these initiatives. There are numbers from different provinces, similar number as national ones, and that we really have problems among childhood. Of course, we can talk about problem in adulthood or quality of service for adults as well. But I think over the last 25, 30 years that I'm working seriously at a managerial level, so to speak, at a professional level, I see there have been significant progress in adult care, has not related to extended to child health. And that's the pain that I have. We've lost hundreds of those children, which I think could have been saved if we had a holistic care system within those institutions. And that bothers me. That bothers us, those who are kind of involved in this whole campaign of trying to do something to help save kids in Nepal. And the other, this right side picture that you can see is a research that we recently published from the QOH itself with the Nepal Health Research Council. We looked at all the big institutions in Nepal where there are pediatric care. The non-communicable disease dominates the cause of admission and the cause of death in these hospitals. So there is now kind of not full evidence to support the hypothesis that I'm bringing, but we have now seen the evidence that unless we start working on treating these non-communicable disease or serious illnesses, I think we could stay there at a plateaued number of deaths among children in Nepal. I think these are the low-hanging fruits have been already taken. Now we have to go one step ahead to treat these children when they get sick. The reality is, unfortunately, the children are still facing widely diverged chances of leading a healthy life based on where they are born, what are their economic situations. That's unfortunate, but that's still a fact. In Nepal, too many still don't get to care. Too many of these kids don't get appropriate care, and let alone getting specialized pediatric care in country. I mean, I have to appreciate the effort that our public institutions are doing, some medical schools are doing, but I think it's far from what needs to be done in current civilized world. If you look at the resources that we have in Nepal today in focusing on children's health care, I can bring up, I'm the chair of Medical Council, as Right Honorable Mr. Khan introduced, and I know the numbers today, we regulate them. I actually represent government myself in that sense, but the human resource situation is improving, but far from having the right kind of skill mix for the population of Nepal. If you look at these numbers, most of the doctors and pediatric beds are focused and located around Kathmandu and Bagmati province. I mean, understandable, but the need is there. They need to be available everywhere in the provinces where there is a lot of sickness, a lot of illness, a lot of problems. It hasn't been that way so far. There's one children's hospital which is dedicated in the public sector, doing its best to cater to the needs of people, whoever comes. But 12 million children, or maybe 11.5 now with the latest census, one hospital with 350 beds. 2,800 beds for 12 million children, it simply doesn't make sense. What is happening with those kids? We really don't know. I mean, they're being treated, they may not have been treated at all, and there's a lot to speak about. And look at the numbers of doctors here. This is kind of a little smudgy slide. We have 32,000 doctors registered in Nepal, and of which about 10,000 are specialists of postgraduate degree holders. Among them, only 781 are pediatricians. See the discrepancy of need. So I think there's a lot to do in producing doctors, training them in pediatrics, and more so, look at the numbers of subspecialists in pediatrics. One pediatric cardiologist formally trained and registered, similar one. So when you talk about subspecialty training, the way we do in adults, really virtually very few people that are serving our children in Nepal. So there is a lot that we need to do in training doctors, in increasing their bed capacity for children, having the skill mix, the nurses, the paramedic who are able to handle the specific way of treating children, which is completely different. And I think many of you would understand children are not small adults. They're different. They're not small adults. Weight divided by 4 doesn't make a child. And this is the objective, to decrease the childhood mortality and reduce the suffering of the kids. And that's exactly what this Sustainable Development Goal that we signed as a member country says. It demands to reduce the neonatal mortality to 12 per thousand. We're still languishing at 21 and it's not going down anymore. So there is a lot that we need to put an effort to achieve to that. So I think this is This is one of the reasons that we thought we need to do something. And being there for decades now, being able to serve multiple institutions in different roles, like myself and my team that is in the board of QH now, we think we need to make a new resolve, making children's healthcare available anywhere, anytime, at an affordable price. And it's easy to say, but unless we say so, we're not going to inch closer to the objectives. The concept we have proposed in front of public, government, and outside world that we really want to do a complementary model to this, to the government road. It's not a competitor, but we're going to have a hospital in Kathmandu which has multiple specialties under one umbrella, which is something that's really lacks today. I do a lot of heart operations in heart hospitals, but when I need a GI guy or pulmonary guy or a neurological problem, then we start struggling there. To have the satellites in each province of Nepal, which have more general pediatric care and have a great line of referral, so that there is a seamless transition of patients from one center to another, and they only come to Kathmandu only for complex cases. That's the concept. Sounds a little big for the model that we have in terms of the funding and the business model. I think this is not big if you look at the needs of the country. Now, for this, we've been engaged with the government of Nepal since a long time. Myself being involved in public sector for more than 2 decades now in leadership roles of institutions. The government has given us a land in Kathmandu, a big piece of land in a prime area, and we have signed an agreement with the government in terms of partnerships, particularly focusing on facilitating the institutions built and owning the program when it starts becoming functional. We're just chatting with His Excellency that this is the right model that we need to pursue. Our government institutions are overwhelmed, and a lot of times there is a problem in management, and we know this, and we don't have to be too critical to say this. We wish they could be better, and luckily I'm proud to say that the institutions that I was lucky to establish and run now, including the Heart Hospital and the Cardiothoracic Center at the university, seem to be doing well, and I feel proud to be part of that. But most of our institutions do not do that well. So I think we want to have the best of these two models, where the management is autonomous with the experts, and government participates in a way that's conducive for the best management model. So this is what I was trying to reflect here. That's the concept. Now, how did we start so far? I'm going to briefly take you through the progress so far that we've done. The concept of hub should come first. A lot of people ask, why Kathmandu, yet another hospital in Kathmandu? Why can't you just go out? The thing is, if we don't have a hub and the resource center in Kathmandu, it would be extremely hard to train people, have this, this centralized resource of technology, human resource, rotating through, going and backing up, and referral. All of that has to be done through one kind of hub. That will kind of manage, train, give them the protocols and standards for satellite hospitals. This time around, we started work in Kathmandu, but in the meantime, we had this request from east of Nepal Province 1, and in the last 2 years, we've been able to establish a satellite hospital, 50 beds now, probably upgradable to 100 in eastern Nepal. That's a great achievement, despite the fact that we had COVID, we had financial crisis, we had all international charities being redirected to newer crisis areas. I think we're very happy that proof of concept was demonstrated in east of Nepal. And I think this is great to see in the last 2 months that we've been running it, see that thousands of children are already being benefited. A great facility. We worked hard to give pretty good, decent facilities there. I don't want to show the videos, but again, even this satellite will provide certain very focused, specialized care, for example, for developmental issues of children. I'm focusing on more hearing, vision, and preventing major disabilities in the future, and of course 1 or 2 specialty services. So this has been a very encouraging and energizing experience for us. The way it has been working is again, as per our model, we want to send our experts from Kathmandu. We have a team of doctors in Kathmandu. Kathmandu Hospital is still under construction, I'll show you that. And visiting that place, helping them out, myself there, professor, pediatrics, originally in New Year's, now back in Kathmandu, and a pediatric cardiologist, 3 pictures. They're going every month to train them locally, help them taking care of the kids, and also take those people to Kathmandu for exchange training. So I think this model, if we continue to build on this model in other places also, I think that's going to definitely bring the standards to a uniform level at all places. We not just do the treatment, but we're also looking at the community services, outreaches from there to the primary health centers. And that's something that really, provokes me in terms of being more active, because we really want to reach out to the grassroots, not just treat in the hospital. So I think this institutional system hopefully will connect the dots. We're not going to replace the public system. We're not going to be taking care of all the problems in the country. We will connect dots, show how is it possible to have a right kind of treatment modality, right kind of protocols and referral pattern, set a standard, so to speak. That way, hopefully, it will help others to get better and help them if they need training. So, the local ownership, at least from the experience of the Eastern Nepal is great. The municipality mayors and ward chairs, everybody got together and saying that this is a great project for Province 1, we need to build on this. And I think that the feedback is great. Of course, unless you do well, deliver good quality care, they're not going to remain supportive for long run, I know that. But I think a lot of local foundations and individuals, the municipalities have committed to support the institutions in terms of sustaining them. And that's going to be a question that I'm going to be answering probably at the end. How do we make it sustainable? These other countries also endorse this idea because it's needed. And now there is a general consensus in Nepal, of course, outside the very fact that you guys are here. I take this as your endorsement of the concept, and I thank you for being with us on this long-term campaign. Now, first 2 months that we're running this satellite hospital now, this outpatient number is soaring up, about 100 patients, 100 kids every day now. And no advertisements, no insurance scheme has been accepted yet. People keep pouring because there is no such facility who could give good quality care at a very affordable price, and of course free care when they cannot pay. There are a few interesting things we already observe in this whole process. Of course, these are the districts that are reflected in the care, so that means that it's not just one district, it represents the whole of the province now, children coming from different districts there. And look at this, I mean, even with this short experience, I mean, you could do that everywhere. In Kathmandu, in Western Nepal, in other hospitals, in Medalis. But look at this is something very sensitive that we need to look at. The sex difference, even in these 2 months, in a few thousand patients that come to us now. Why is this discrepancy? Why males are showing up, boys are showing up than the girls? And I think there's a lot for our public health guys and ourselves to look into what's this scope for equitable health care. Even in a place like Jhapa, which is generally much more forward than most of these northern sites and districts of Nepal. The feedback is tremendous, children are happy, families are of course happy. There are issues with financing of the service there, how do we pay for salaries? People cannot go there, don't go there unless you pay good salaries for doctors and nurses. I mean, there is a long story to talk about this, but we really think that if we provide good quality service, there will be ways to sustain that, and we already have that calculated. The Kathmandu concept, as I said, we wanted to do it first, but because we got that opportunity to prove something on the ground, we started off with satellite, but this is also taking off ground now. The idea is that we have all these major specialties under one umbrella. Of course, we will go gradual, not going to be one at a time shot, because it's a long, difficult process, especially when we don't have a lot of trained specialist doctors and nurses who can take care of our very little kids. But this is where we are in Kathmandu now. There are 2 major buildings. One is outpatient clinic building, which is almost finished, and the major hospital building is being founded as we speak now. This is a couple of weeks old picture. I hope there have been changes since then now, and hopefully there will be slabs now. But I think it's taking off. And one more thing that really attracts me to this concept is that we just don't want to stick to the hospital care. We want to see how do we prevent those diseases, how we work with the district hospitals, how we strengthen their services, because we have the connection, the background, the knowledge of those hospitals from our own previous experience. And we work with 6 district hospitals in strengthening non-communicable disease care, partnering with UNICEF now and a couple of districts with Harvard Group. So I think this is something that really excites me, that our institute probably would like to expand not just as a hospital, but also as a place where we do public health, we do research, and hopefully in the long run do more basic research. This is a question everybody will ask. I answer you before you ask. Is how do you sustain this big project? It's a huge undertaking for the model that we have. Yes, as I said before, if you consider the need, it's not a huge project for a big foundation, big, let's say, we have a lot of those big projects. Nepal actually was able to declare 753 primary level hospitals at once. Right or wrong? Now, tell me, we're talking about only 7, but very focused, specialized institutions dedicated to children. It's not big, cannot be big. There are problems, but good thing, as I said, is Nepal has done very well in some of the welfare work, child health, in pediatric cardiac care. There are a lot of 11 different major conditions that government sponsors and supports. All of those projects, schemes could be part of our institutions because we are eligible for it. So then we have the revenues, secured. At the same time, poor children will get free care. They don't have to pay from the pocket. There is a national insurance, very problematic at this stage, but I know this national health insurance has to move forward. It will. It has to. There's only one option for the insurance to get better. So I know this will come into play, then people don't have to pay from the pocket, which again will make sure that our institution will benefit from the insurance scheme by being sustainable in the market. There are CSRs. Nepal already has this mandatory 1% CSR funds that every profit-making institution has to set aside, which again, we are competitive for it. Hopefully, if we do well, people would like to be part of this, and that will be there. There are a number of other ways, and of course, those we can pay, will pay, have to pay. It's not going to be free ride. Only thing is, who's going to pay for poor? That's the question, right? So we're going to come up with a model. So all in all, I think if we do it right, if we have a quality service provided, financial sustainability probably is achievable within 3 to 4 years. Now, I can vouch in front of all of you. I've led public institutions where we're in profit, not profit. We don't call profit for public savings. Koirala now saves 20 crore rupees a year. Saves. Possible if you do it right, if the business model is right. Despite the fact that they give a lot of charity and free care to all of the children, senior citizens, rheumatic heart disease, and all. So I think it's all about efficiency of care. So I'm not going to bug you with a lot of other numbers. What are we planning in future? Well, first, two things first. Let's get the Kathmandu project going. Once we get to the complete of this, so we want to expand to the 3rd site, probably west, where there's a lot more difficulties. The numbers are poorer. The healthcare is at a much lower level, so maybe far west, Midwest. Well, that's after we settle in Kathmandu. So we want to add academic partnership in the long run. By virtue of law, we're not in academic institutions per se, but we can partner with academic institutions. That's the idea. Add research as one of the key areas. And of course, transformation and innovation that we don't care much about in our public institutes should be the pillar of our institution. We're already working on it. And of course, international collaborations. This is going to be an important factor for us to train people, have an exchange, give the best examples of the world, copy the best practices. I think this partnership, collaboration, like with many of you, is extremely important for an institution to survive, flourish, and give good quality care to our children. Now, I'm going to be finishing up. Everybody will have questions in their minds. Why you? This should be done by the government, right? Yes? But we also am a part of the government, right? So why not us? And it's not a competitor. We want to help. And I think hopefully next 5 years or 7 years, it will be a system dedicated to public care, complementing the government, probably through the government funding scheme or at least the programmatic schemes. So it's partly a project partnering with the government. So we ought to do this. We're supposed to do this. Why Kathmandu? As I said, I think it's very clear, unless we have a hub and resource center, it's extremely hard to send people out to the remote areas to train them, to have the protocols set and standardized. How about this fundraise money transparency? A lot of people have done a lot of nonsense with fundraise money. I think all I can say you is look at the track records of the board members, including myself. So we've been there running institutions for the last 25 years. And luckily, I can declare today, at least in the places that I've run signed checks, the Auditor General has not raised a single penny of irregularity so far, except for the Saidantik Beruzi that they call Rakam Gaddas. So I think that's something that I can be proud of. So how to sustain, I think I partly answered that. So with this, I'll probably stop it here, and I'll let you ask questions. And I didn't put a question here because this hall probably was not appropriate to ask this question. And the final FAQ is that how can I help? So there are a lot of ways. It's not just about money. It's about technology transfer. It's about training. It's about networking. Just being part of this conceptually and supporting the cause that children in Nepal deserve better care than today. Thank you very much.